Hello, I'm Kelly Owens and I will be discussing my capstone project for my Bachelor's of Applied Sciences class, the nursing shortage and quality patient care. I've worked in healthcare for 20 years and have witnessed the effects of poor patient care in my professional life as well as my personal life. Being an LVN, a licensed vocational nurse, and dealing with patients in long-term care facility, I've seen patients discharged from the hospital after not receiving the quality care they deserve, as well as being discharged much too early. I've also been on the other side of the coin as a patient. I had a 9-hour surgery and I was taken care of by a great nurse, but unfortunately she was so busy with other patients, she was not able to give me the quality care that I needed to recover as soon as I was supposed to. I was lucky enough to have my sister there, which was an RN, by my side to help me recover. I decided then to try and fulfill my lifelong dream of becoming a registered nurse, but due to the many roadblocks to actually being accepted into a program, I have yet to fulfill that dream, and it's been about 10 to 11 years. I'll be discussing the way to minimize the nursing shortage and any effects it may have on the quality of patient care. When there is a nursing shortage, it doesn't just mean that the hospital doesn't have a nurse for every patient. It means much more. Medication errors are one of the dangerous effects of a nursing shortage. They're most commonly caused by human error. This human error happens more often than not due to nurses' fatigue from being overworked or being in a hurry to complete the almost never-ending care that the patients need. Another reason for the nursing shortage, another reason that we need to take care of this nursing shortage is the infection rate or the increase of infection rate. These rates increased when nurses are responsible for too many patients and take shortcuts and not are following the infectious disease protocols that need to be followed. Another danger of the nursing shortage is the increase in readmissions. Increases of readmissions happen when nurses are unable to give the patients the complete care that has been ordered by the attending physician. Therefore, the patient does not recover from the primary diagnosis and can end up with a secondary diagnosis that can cause a readmission. Another danger of the nursing shortage is patients that are being discharged too soon. Patients that are being discharged too soon, it happens often when the nurse aids in the care and reports back to the primary care provider with the patient outcome. On many occasions, the nurse is responsible for a number of acute patients and cannot access their care completely, leaving the patient to be discharged without proper healing, therefore can also increase the admissions. What are our problems? Well, there's quite a few to speak of. One of the problems with these issues is the nurse to patient ratio. It is unacceptable. One nurse to 5 to 6 patients that are taking care of the severity of a patient could be from prior surgery or recovery from surgery to someone who may have had a stroke. This puts the nurse in a position where the patient may not get the proper care to recover and receive poor patient care due to them being responsible for too many patients at one time. Another issue is the nursing programs and how impacted they have become over the last 10 to 15 years. Before that, a person could apply, and if they had any medical experience, along with mediocre grades, usually a C or higher in the prerequisite classes, they would be accepted. The requirements have drastically changed. Now many programs require a 2.5 GPA in all science classes and only accept students in a lottery system. That being said, the lottery system, if you are applying for the nursing program, it can take you 1, 2, 3, 5, 7 years. It just depends on if you're lucky or not, unfortunately. And when you do apply, it doesn't carry over to the next year. You have to reapply every single year. Let's see. The programs are also impacted due to the shortage of the instructors for these nursing programs. The nurses that become instructors, they are not getting paid significantly enough to work as a instructor. They find that they can make better wages if they work in a hospital setting rather than teaching at a university or a junior college. Another issue is the unsatisfactory work conditions that nurses can have. These conditions these conditions are increased by insurance requirements. So an insurance can say that they will cover the patient's stay or they won't. The work conditions can also be affected if the hospital administrator is wanting that nurse to do some sort of care or take a shortcut, unfortunately, for some sort of care. Also, the severity of the patient's care is a problem when it comes to unsatisfactory work conditions if there isn't proper medication or the proper equipment. Now, if that medication or equipment is not reachable or in the area that the nurse needs, they have to go find this medication or find this equipment, and that puts a damper on them being able to take care of the other patients that they have. Therefore, makes an unsatisfactory work condition. The other major issue with the nursing shortage is the retirement of the baby boomers. The impact of the nursing care, this can impact the nursing care in two ways. The baby boomers are retiring, so there are lots of nurses that are baby boomers and they're retiring, and there aren't any nurses to fill those spaces or those careers. Another issue with the baby boomers are that they are getting to the age to where they're going to seek medical attention or need more medical attention than what they have needed. So therefore, we won't have enough nurses to actually take care of them. So another problem that we have, not just for the baby boomers, but also we as humans now are living longer, making for the nursing shortage to be worse or become worse due to needing more nurses to take care of more people that are living longer. So, how to minimize the nursing shortage and any effects it may have on quality patient care? Well, there are many ways that we could possibly do this, but there are and will be many ideas that you may hear or may come about, but I do believe that paying nursing instructors more and altering the nursing program acceptance policies will make a big difference in the shortage of nurses. I also think that nurses need to be responsible for a specific number of patients that are feasible to ensure patient safety as well as satisfaction. So not only is it too hard for the nurses to take care of too many patients, but the severity of those patients can hinder that nurse giving that patient the care that they need. Therefore, that patient will not be satisfied with their care. So, in conclusion, I just want to say nurses are the answer to quality care, and without them, the sick and dying will not receive the care they deserve. the care we as humans all deserve, not just anyone, but all of us. Whatever the answer to the nursing shortage is, it is imperative that it is solved. I truly think that if nursing programs went back to monitoring applications for experience as well as grades and accepting those with experience, the nursing shortage and quality patient care would be something of the past. Thank you.